Okay, welcome everyone. This is another episode of Making Orlando a Better Place. We have an awesome guest today, Scott Smith with Central Florida Functional Medicine. Thank you for taking time out of your day to meet with us, and this is gonna be an awesome conversation. So many people are asking me questions about gut health and what it is, what does it entail, how does it factor into certain diseases, and thank you for taking time out of your day to meet with us and talk all things gut health.
Ron, I'm excited to be here. I love talking about this stuff.
Yeah. From our conversations in the past, I believe what did you do your dissertation on?
Small intestinal bacterial overgrowth.
Yeah, so perfect. I mean, you would be perfect to talk about this. So again,
Yeah.
thank you for just taking time out of your day to do this. Everyone, I'm going to put his link and everything in the bio so you can read up and find out more information, his advanced studies and how he got his functional medicine training and stuff like that. We can skip all that stuff and kind of go into the details. So, in general, when someone talks about gut health and the gut microbiome, how do you describe that to them? Like, what is gut health and what is the gut microbiome?
Ron, this is an area of medicine that is expanding very rapidly right now. We're learning more about this every single day. I can tell you for a fact that the DNA circulating around in my body or in your body, only 10% of it was generated by us. The other 90% of it comes from your microbiome. And we're learning all the time about the new roles the microbiome plays in your overall health. And I like to think of it this way. The GI tract is where the outside world comes in the closest contact with your inside world. It's like the front door of your house. It's where you're going to get the most exposure to your environment and surroundings. We want to make sure that that's working well. And because it's designed to interact with the outside world, the body understands that this is a point of great vulnerability. And so it keeps about 70 to 75% of your overall immune system is just protecting this one organ. So it's a super important interface that has to be working optimally if you want to have any success at long-term health.
Whenever someone, like, what are the components of gut health? Like for cardiovascular, we have the heart, we have the arteries, we have the lining in the arteries, endothelial dysfunction, stuff like that. Whenever you say gut health, is it just what's inside the gut and the gut lining, or are there other components that are involved in the gut microbiome?
Yeah, so really it's a continuous mucosal surface from mouth to anus. So I mean, it could include the oral cavity, esophagus, stomach, small intestine, large intestine. But to be honest, most of our concern is that interface at the small intestine. That's where that GI mucosa layer is only one cell layer thick, Ron. So the difference between having a life of medical chaos or a life of normalcy and health is only 1/18 the width of a single eyelash. Incredible.
Yeah. So then, is that what like that gut lining? Is that where leaky gut happens when like people hear about that?
Yeah, it is. So in the small intestine, because that's where you're supposed to absorb nutrients and other molecules that are beneficial for health, that cell layer is only one cell layer thick. They're held together by what we call tight junctions. So they're kind of like zipped up like the zipper on your pants or in your sleeping bag. When that zipper is nice and tight, your GI tract doesn't leak. When that zipper starts to fail and those tight junctions start to get wide, that's where you lose control over what's having access to your body. And we start having poorly digested foods leak through and microbial byproducts and toxins, things that don't offer us any nutritional or health benefits and are actually quite stimulatory to the immune system, trigger inflammation, have all sorts of other consequences. That's one of the reasons why the symptoms associated with gut health are so vast, and very few of those symptoms are actually GI symptoms. So I think a lot of people are confused when I tell them that's their GI tract that's the source of the problem, but they're really presenting with chronic headaches or brain fog. Then I have to kind of explain that link.
Hmm. So then, how do you measure gut health? Like whenever you're like, if someone wants to measure it, what's the best way to measure it, and how do you even measure gut health?
Yeah, I mean it's not an exact science for sure. And a lot of times we start thinking gut health when people come in and have multiple symptoms that don't seem to be related at all. Right. Oh, I have transient joint pain and I have headaches and I got rosacea. Like you'd think that those would be three completely separate things. Like, oh, you need to see rheumatology and you need to see dermatology and you need to see neurology. But the fact of the matter is the lowest common number potentially could be your GI tract in a scenario like that. So you can do stool testing that can look at your microbiome. That's not exact science, but it's pretty good. PCR testing is the newest kid on the block that looks at the DNA the DNA sequencing for bacteria, so it doesn't have to grow completely in a culture. You can do testing
Excuse,
on
yeah, excuse me for interrupting. What's PCR?
PCR is polymerase chain reaction. So it's a type of testing where traditionally, like if you want to look at the bacteria in the GI tract, it was always done as a culture where they take a sample, they put it on a petri dish, and they'd see what would grow. But we know that much of the microbiome is anaerobic, and so as soon as it hits air, it doesn't survive and won't grow on a petri
Hmm.
dish. So they started to develop newer technologies that allow us to take a look at that microbiome and the contents of that microbiome that wouldn't survive agar plating and culture.
Oh, okay. So that's nice stuff. So that's the new test coming out,
Yeah,
pretty
so the
much.
best testing that we have right now have a combination of both, where it has some culture component and some PCR component. And then when we're talking about leaky gut, you can also measure it on some urine samples as well, because there are some metabolites that we know only come from bacterial origin. And if we can capture them in the urine, we know that they've escaped the GI tract. So that can give you some idea of what's happening in the gut as well. And then lastly, when people do IgG based food testing, we're not doing that testing to blame a particular food. It's not, pork chops or applesauce or green beans that are the problem. The problem is that those foods are getting through the GI tract lining, not fully digested, is making an immune response. So we use some of those food hypersensitivity or sensitivity testing to see how leaky is it to just the food component. So it's usually a
Mhm.
combination of those, depending on what it is we're trying to achieve. That will give us a good understanding of what the gut function is.
Okay. How does someone even get poor gut health? Like, what are some factors that kill gut health? I like to keep things really simple. There's things that increase gut health, and there's things that decrease gut health. What are some things that decrease gut health? Whether it's lifestyle factors, are you born with it? Is it a DNA genetic thing? Like, what things that come to the top of your mind, simple things that decrease gut health that would lead someone to have a bad gut?
Well, unfortunately, the harsh reality is that people don't end up with good healthy guts nowadays by accident. It has to be an active process because everything kind of sets up against you on this. Heavily processed diet, low fiber content, poor nutritional status, elevated levels of stress, poor sleep, smoking, alcohol, lack of physical exercise. These all play contributing factors on here. And add on to that, if you're a baby born by C-section or you're not breastfed, those are things that have increased risks as well. We also have a lot of antibiotic use, and I'm not anti-antibiotic, but you want to make sure that when you're using an antibiotic, it has a good intent and purpose, because otherwise you're disrupting the microbiome. Studies on clindamycin showed that one course of clindamycin can have a disruption of your microbiome that can last for 3 years from one course.
That's interesting. And you brought up antibiotics. Like, as soon as you mentioned that, not just when you're sick and getting an antibiotic, what antibiotics are in our food or in the chicken and the steak and stuff like that? Is that indirect antibiotics that could be affecting us too?
Yeah, actually, the number one sales point for antibiotics is not for humans, it's for livestock.
Yeah.
So most of the antibiotics used in the United States are put into our food supply. Add into that when you're eating non-organic and you're cross-contaminated with glyphosate or emulsifiers. These are things that we know that studies have proven. We can look at PubMed studies on these that have shown to disrupt the GI tract mucosa in a variety of ways, whether it disrupts the microbiome or it thins out the mucosa layer, or sometimes even some of these products just break the tight junctions up in and of themselves. These are all added problems. So it's hard to have a healthy gut nowadays unless you're specifically aiming for that.
So is gut health kind of like a ever evolving thing? It's going to be certain lifestyle factors and what you consume maybe make it worse, and then you may optimize it and then it gets healthy again, and then it kind of fluctuates. It's always evolving. Is that how you view gut health? It's not always going to be always bad and always good. What you consume and what you eat and exercise and alcohol consumption, it's just a never ending whatever, like it's always fluctuating, right?
Yeah, there was a point in time where people thought like your microbiome was just kind of locked and loading, and it is what it is. Like if you broke it when you're young and your gut associated lymphoid tissue or your galt was already established, there's really nothing you can do. But in reality, we now know that with major dietary interventions, like if you go from like an animal protein based diet to a vegetarian diet, we can see changes, significant changes in the microbiome in 48 hours or less. Like it can
Mm.
adapt and change very rapidly. So yes, if you go on a cruise for 2 weeks and you're indulging, you're going to come home with a GI tract that was not probably as healthy as it was the day you got on that ship.
This is just me asking a personal question. Does using that antibacterial soap on your hands affect gut health?
Probably does to some degree, right? So your body has um, a microbiome all over the place, even on your hands. So we have commensal bacteria that help us out, and they play certain roles. And so using an antibacterial soap on your hands is going to start changing around that microbiome, and some of it's going to cross contaminate. You're going to put your hands near your mouth. You're going to have it on your toothbrush. It's going to cross contaminate. So yeah, I think it's a risk factor. I don't know if it
Well,
would be in my top 10 highest risk factors, but
yeah.
it's a risk factor.
How about mouthwash? Because we're taught to use mouthwash for gingivitis and oral health, but does that kill gut health? Does it affect? Because the gut goes all the way from your mouth all the way down to your anus, really. So, what are your thoughts on focusing on gut health? What does mouthwash do to it?
Yeah, it's not great, Ron. That's a good point to make. In particular, we know that your body needs a product called nitric oxide. And all of your nitric oxide supply is generated from the bacteria that lives on the posterior portion of your tongue when you consume the right amounts of foods. So we know that people who use like alcohol-based mouthwashes and it kills off that microbiome, that they'll start to have disruption of their endothelial layer of their blood vessels, be more likely to struggle with things like hypertension because that nitric oxide is supposed to relax the blood vessels. All
Oh
comes
my
from
goodness, that's
mouthwash.
awesome. I like nitric oxide with vasodilation, especially when I exercise. So that's
All of
good.
it is made on the back of your tongue and it's stored in the salivary glands.
No way. That's so interesting. Oh, wow, that's fascinating. So we just talked about things that decrease gut health. What are things that increase gut health?
Yeah, there's a lot of them, and we're not expecting perfection from anybody, Ron. That would be impossible. But consistency, right? Consistency. So managing stress levels. Everyone's got a pretty high stress level, and that stress is not just like I'm so stressed out. Stress can be interpreted by the body as a physical stressor, like I'm overtraining, like I'm training for a triathlon, or it could be an emotional stressor, like your cat ran away, or it could be a medical stressor. And it's really a combination of all those things. So you want to make sure that you're doing things that keep your stress levels as low as possible. When you have high levels of stress, the cortisol generated from stress breaks down the GI tract mucosa, and the inflammatory cytokines also break down the GI mucosa. So chronic stress and leaky gut, they really go hand in hand. Poor sleep in addition to triggering a stress response, sleep in and of itself have been shown to be a risk factor for GI health. So good sleep and exercise on the two extremes. So people who are not physically active are going to struggle. They're going to have more inflammation in their GI tract. They're going to be more permeable. Their mucosal layer is going to be thinner. The mucus is going to be thin. The microbiome is going to be shifted. And then people who overtrain, like I don't know about you, but we have a few patients who do things like, I don't know, I run 2 Ironman triathlons a month, or I do back-to-back marathons on a Saturday and Sunday. We know that people who do those extreme sports, that they will struggle with blood in their stool and increased amounts of translocation of toxins from their GI tract into the bloodstream, like lipopolysaccharide. That'll be elevated for a period of time after that stressful event. So overtraining and no training at all are both risk factors, lifestyle-wise, for an unhealthy gut.
I don't want to go down the rabbit hole of probiotics, but what are your, I mean, like, can someone take pre and probiotics to increase gut health, or is it more complex than that?
Yeah, it's probably a little bit more complex than that. I mean, those are a great starting point, and it's a great tool. So normally when I want to heal the GI tract, and again, I'm primarily concentrating on that small intestine because that's where the interface with the outside world is. I want to use something that's going to repair the epithelial layer, like a glutamine-based product. I want to use something that's going to thicken up that mucosal layer, like Slibrium or something like that. And I'm going to use something that's going to manipulate the microbiome. That's where your pre and postbiotics come in, and probiotics.
This is another question I have. So I guess to phrase this, are all probiotics that aren't refrigerated garbage?
No, some of them the technology is pretty good. So I mean, you don't
So
ever want to.
you can actually have a good probiotic that's not refrigerated.
You can. I mean,
Okay.
think about it. They live in the human body at 98.6 degrees. So I mean, they're designed to be in a warmer climate. Now, don't buy a bottle of high quality probiotics and leave it on the dashboard of your car while you go have lunch somewhere. That would not be a great thing here in Florida.
Hmm.
But a lot of the probiotics, especially the higher quality ones we use, they've been tested to be stable at room temperature for up to 1 year past expiration date. So some
Oh
of the
wow.
technologies are pretty stable on these.
So it's getting better. That's good. So we talked about gut health, what it is. We talked about how to increase it, how to decrease it. Now let's kind of talk into gut health and disease states.
Sure.
Um, because you said something fascinating when in our conversations in the past, but what type of disease states kind of are linked to gut health?
How much time you got?
I know, yeah.
They can break down into a couple of different things. I generally, in my mind, I break them down into two giant subsets, like the GI based issues and then the non GI based issues. I'm not going to spend a ton of time on the GI based ones, only because they're so obvious. Like you can get constipation, you can get diarrhea, bloated belly, and distension, reflux. These are all can occur, and that would make you think gut. It's the things that are not happening in your GI tract that I think people struggle to make that link. So if you come in and you got multiple food sensitivities, like we have people all the time to come in like, yeah, well, I can't eat this, 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 and this because I know they just disagree with me. There's something wrong. I doubt that you're reactive to all those different foods under all those different categories. There's got to be a common denominator. That GI tract is probably damaged. People with chronic headaches, people with brain fog, people with fatigue that's not better explained by something more common like iron deficiency anemia or thyroid issues. We should be thinking GI tract in them. Probably one of the most common things that I see with people who have damaged GI tracts would be right up your alley. These are people who come in with transient joint pains, and it doesn't really fit the criteria for, say, rheumatoid arthritis or osteoarthritis because it's transient. It's not bilateral. Like one day, it'd be like, oh, my knee is killing me, and 2 weeks later, it's their shoulder, and then it's their thumb. It's transient. We know there used to be something called Reiter syndrome, which now I think goes by the name of reactive arthritis. And I know one of your questions you had pre-sent me was like HLA-B27. And the HLA-B27 kind of loads the gun, but it's a toxin that comes in from the GI tract, whether it be from a bacteria called Yersinia or other things like gram-negative bacteria like Citrobacter or Klebsiella that pull the trigger. That's when you get the actual disease state of, like, say, ankylosing spondylitis or reactive arthritis. You have to have the bacteria component from the GI tract leak through and then be genetically vulnerable with the HLA-B27.
Is that pathway linked with those things that you just said through autoimmune pathology?
It is.
Or are there
It is.
other ways? It's just considered an autoimmune pathology, correct?
It is. Now, like I had mentioned, the small intestine is a point of vulnerability. So the body keeps about 70-75% of the immune system that lines there. Imagine that your GI tract is leaky, Ron, and things are coming through all the time, and it's setting off this signal of inflammation and immune system activation. The more activated it is for the longer period of time, the more likely the immune system is going to make a mistake. It's not infallible. It's going to make a mistake. And I think those are your potentials for autoimmunity. Almost without fail, about 20% of the United States population has a positive ANA that is not seroconverted into an illness. Right? It's not Sjogren's and it's not lupus. It doesn't have any endpoint to it. Almost without fail, those patients are patients that end up with severe GI tract anomalies. And it's not uncommon, not 100%, but not uncommon that when we tackle those GI anomalies, that the ANA actually corrects itself.
Okay, so have you ever seen that? I know it's a Netflix documentary and it's a sample size of one, so it's an N of one, but did you ever see that documentary with the one girl who had history of um she had all sorts of gut uh issues and it couldn't be fixed. And they opted for a fecal transplant as an end all be all to try to fix her gut health. She had all sorts of di diverticulitis, cystitis, all this stuff, and they couldn't fix it. So it was, again, this is a sample size of one. I would love your thoughts, but I've never seen this in a clinical state link between two diseases. So she ended up using her boyfriend's uh, fecal transplant, and the boyfriend had like a skin disorder. I forget the name of it. It might have been reactive arthritis or anything, but he had some sort of skin disorder. And when she used his fecal transplant, she started to get the skin disorder. Then she was like, forget that. I'm not doing this. So she used her brother's, and her brother had clinical depression. And when she started using his fecal transplant, she started to get clinically depressed. I have never seen a case of this before in my life. Now, again, I get it. It's a Netflix documentary. It's a sample size of one, but it clearly shows how gut health can have a link to a disease state with the skin disorder, but also brain health and mental health with the depression. One thing, what are your thoughts on the brain gut connection also, besides just the disease gut connection?
Well, leaky gut and poor gut health is linked with depression, anxiety, OCD, memory problems. It runs the whole gamut. And even in my clinic here, we take care of a lot of kids with autism. We can often see a fair amount of improvement in overall symptomatology as we get that GI tract healthier. And I believe that there's some similar studies, even all the way to things like psychosis or schizophrenia, that dietary manipulation, changing microbiome can actually relieve some of those symptoms. So this is probably the area where most of the science is coming in right now. Harvard University, Duke, Stanford, they're all, hard pressing to get this information.
That's nice that you even said that they're proactive doing it because I think standard healthcare is way behind with this.
Yeah, yeah. And
Way,
even
way
fecal transplants,
behind.
I'm a believer in fecal transplants. Outside the United States, fecal transplants are not an anomaly. Here in the United States, we can only have them FDA approved for C. diff, and that's only recently that came to be. But in other countries, they use these to treat multiple disease states. We know in animal and human models that if you give a skinny fat rat poop, that rat will become fat. Or if you give a rat with diabetes, the stool transplant from a rat that doesn't have diabetes, that the diabetes, type 2 diabetes, does start to go into remission. Like
Yeah.
we talked about,
Wow.
only 10% of the code that's circulating in our bodies right now, we actually generated ourselves. The rest of it comes from the GI tract, right? So when you have a wholesale switch in your microbiome, the code changes. So even though it may not manifest itself as a lot of GI symptoms, the code that's being sent out to the rest of the body is really weird. The analogy I like to use, Ron, is like if I went to like Best Buy or whatever, and I bought Microsoft Office for an IBM computer. I tried to install it on my Apple, it doesn't install right. When I go back to Geek Squad, I tell them this gonna be like, you crazy old guy, right? You got the wrong program for this. Like same thing. So when you have a wholesale switch in your microbiome, like the code that's sent out is giving a completely different code, right? So the GI tract is responsible for. We know that it's linked with immune system function, obviously digestion, neurotransmitter formation has a lot to do with this. This plays a huge role in big time functions of the human body, that if your microbiome goes bad on you, those will happen systemically. Like you will be not a fully functional or top functional human if your microbiome is suspect.
Yeah. I remember I dated a girl in college and she had IBS, irritable bowel syndrome, and her struggles, and they used to always say her anxiety causes her irritable bowel syndrome. Now going through everything that I know and talking to you and working with you and researching it, it's almost like the gut health is probably causing the anxiety. It's like we're treating it the wrong way. It's like for years they used to just blame your anxiety is causing your gut problem and your irritable bowel syndrome.
Yeah.
And it's kind of reversed. I bet you the gut health is causing the anxiety and the irritable bowel syndrome.
Yeah, I mean, it's probably bi-directional, but I think the preponderance of it is GI to brain, not brain to GI.
Yeah. So this is probably my number one thing that I learned from you, and you said it so well. I love your analogies. I love how you simplify things. I love going by the KISS principle, where I asked you once, like, what causes autoimmune disease? And you put it so good in such a simple way. And I tell this to patients all the time, where there's two main factors with autoimmune pathology. There's poor gut health and microbiome and a trigger. And the combination of those can create whatever the trigger is. Now, there's a bunch of different triggers. The combination of both leads to an autoimmune pathology or a state. Is that correct? Did I say that wrong at all?
I think you may have said it better than me, but yeah, I think that sounds right on the money.
It's so good. It's so simple because, again, if you look at just treating cardiovascular disease, you have three main pillars, but autoimmunity. So the way that my brain goes is, can you take out one of those triggers? Can you isolate and function and solve the gut health problem and turn off the autoimmune pathology?
Yes. So we don't have to look any further than the tennis star Venus Williams, who was diagnosed with Sjogren's syndrome, got pretty sick with it, tried to go the traditional route, wasn't handling the medications very well. She wrote a whole book on this. She decided to go and do an organic diet, a plant-based diet, and she was able to come off all of her medications. And that's when we see her show back up on the scene playing professional tennis again, is once she got her GI tract healthy naturally.
Yeah, that's
I'm not
awesome.
necessarily advocating that it has to be a plant-free diet. That's just what she used. I think there's multiple approaches you could use for this, Ron. But But yeah, she chose an extreme route and she got an extreme result. It was amazing.
If we go back to just GI tract pathologies with poor gut health, what is the difference between gut dysbiosis and SIBO and like leaky gut? Like, what, I guess, what are the most common gut problems that are diagnoses, I guess, or disorders? And then what's the difference between the common ones?
Sure. So let's just start with the biggest umbrella there, which is dysbiosis. So dysbiosis just means that somewhere in the GI tract, mouth, esophagus, stomach, small intestine, large intestine, you have a shift in your microbiome, right? So either you've got too much of a good bacteria or a bad bacteria or some other component, a yeast, a mold, a fungus, a virus, something that's come into that microbiome that's out of balance with where it should be. That's dysbiosis. Now, if that dysbiosis happens in the small intestine, that narrows down to SIBO, small intestinal bacterial overgrowth. And there's no rule that says that your small intestinal bacterial overgrowth has to be from a pathogenic bacteria. We see people here with SIBO that gave themselves SIBO by taking too many probiotics themselves. They created it themselves. So keep this in mind. I'm a numbers guy, Ron, right? So the small intestine has 10 to the third power of bacteria per deciliter of fluid versus your large intestine, which is about 10 to the 23rd power of bacteria per deciliter. So there's a big difference between those two. If you start to overpopulate the small intestine, that number goes up, it starts looking more and more like the large intestine. You end up over fermenting food, causing this SIBO type of phenomenon. Now, leaky gut can occur for multiple reasons, but SIBO is a big cause of leaky gut. Poor diet, lifestyle factors. So leaky gut is a little bit more universal with damage to that small intestine. When we're talking about leaky gut, we're really not talking about the large intestine being leaky. The large intestine mostly absorbs water and a very small amount of nutrients, but the small intestine is really where we interface, and almost everything that we need to survive comes through the small intestine. And by that, it's designed to be thinner, it's designed to be more permeable and flexible. But when you take advantage of that, it becomes hyperpermeable. That's that leaky gut phenomenon.
So is SIBO a type of gut dysbiosis?
It is, but just to the
Okay.
small intestine,
Okay. And
right?
then with leaky gut, where is it leaking into? Like, is it going to the blood? And can you do a blood sample just to diagnose leaky gut? Is there gut stuff floating around the blood?
Yeah, this is not exact science, but in mainstream medicine, we would call this endotoxemia, right? And it's pretty dangerous. Like if you're going into liver failure and you can't clear, the liver's primary responsibility is not clearing out medications or whatever, it's clearing out the toxins that leak through from the normal microbiome so it doesn't get systemically circulated. For people who go into liver failure and they can't even clear out a healthy microbiome, we call that hepatic encephalopathies. These people don't remember the names or where they live. We put them on an antibiotic, we decrease that bacterial population, and all of a sudden, like within a day or two, all their faculties come back. It's quite amazing.
If we stay on the topic of like disease states, do you feel that gut health and gut microbiome is probably the number one risk factor of why kids and adolescents have behavioral issues, ADHD, OCD, mental health? Is it an underlying risk factor that's not being addressed on why our youth has so many behavioral and mental health issues?
I think it's a major player here. So when you pick up all these things these kids eat, I can't pronounce half of them. I do this for a living, Ron. I still can't pronounce half the things that are in our kids' food supply. Even the American Academy of Pediatrics is starting to catch on here a little bit. They're even saying things like red dye number 40 or blue lake number 40, that these might be problems. But I would tell you that we have multiple chemicals in our food supply that are not allowed in other countries. So we have kids who are really super sensitive and adults who are really super sensitive to foods here. They go on vacation to Italy and they're like, you know what? I was there the whole time and my gut was fine. Yes, because the products that we are allowed to consume here are not available in the food supply in those other countries, and so you're eating a much more clean product. So even though you might be eating gluten and you might be eating dairy, which affect you here in the United States, it's going to have less of effect because it's not accompanied by all these other plethora of toxins that we have to have in our food supply here.
I'm still blown away when I
It's
have a
really hard
patient.
here, Ron. It's really hard to eat healthy here.
I am blown away when a patient tells me they have celiac disease. And when they go over to Europe, they can eat the bread and the pasta. And they're like, I felt I was fine. I could go eat that. I was like, what do we put in our food over here that this person can't eat pasta over here? Like glyphosates or whatever it's called and stuff like that. It's like, that is mind blowing. What are we putting in our food over here that someone has full blown celiac disease here, but then they can go over to Europe and eat pasta and bread? It's like mind blowing.
So if I could just stay on that topic for just a second, I'm a bit older than you, Ron, probably a fair amount older. So I don't know if you remember this, but in the late 80s, when Ethiopia was going through famines, we were sending them food and they wouldn't unload it from the docks. They chose to not eat it and to pass away from famine because they didn't want to eat our genetically modified food. But we genetically modified wheat to contain more gluten than wheat is supposed to contain. So that's a starting point. And then to increase the yield of our harvest, they used to cut wheat and let it dry. Now they'll spray a last round of glyphosate on the wheat so it can be chemically dried and then it's
Mm.
taken right to manufacture. So you got a fresh spray of glyphosate right before it's being taken to go turn into your bread or cupcakes or cookies or whatever they're turning that into.
Yeah, so I mean, overall, to summarize this, it's like pay attention to like the disease states of what a poor gut can have, not just in the GI tract, but also from a systemic disease or autoimmune pathology, and also even looking at mental health and even the brain. There is a brain gut connection and a gut disease state connection, which is mind blowing. I think that's fascinating stuff. And then I guess the next question is, how do you fix poor gut health? I know that Mark Hyman and the Institute of Functional Medicine goes by the 5 R's. Do you follow that step-by-step pathway to fix gut health, or do you have your own way? What are some simple steps that you use to help fix gut health? I'm not sure if you do the 5 R's or not.
Yeah, I mean, 5R is a good, it is good, right? And so what I like about it most is that the average person, they think their GI tract is unhealthy, and so they'll jump right to replace, which is giving probiotics. But as you know, in the 5Rs, that's not the first step. The first step in the 5Rs is remove. Like, let's get rid of the toxins. Let's clean up your diet. Let's get rid of the stress hormones. Let's get the things that are damaging your GI tract first, and then you can build it back up. You can't remodel your kitchen at the same exact time that you're doing the demo on your kitchen. The demo has to come first.
Your analogies are awesome. They make so sense. They're so good. But yeah, I mentioned gut health about to a lot of people about it. They come to me with like a certain problem and it's beyond kind of physiotherapy stuff sometimes. And I mention gut health and they're like, oh, I eat healthy and I take a probiotic. And that's their instant go-to. People don't know the 5 R's, and then sometimes to fix gut health, you have to remove and stuff like that. So you pretty much treat gut health through the 5 R's. That's your
Yeah, I
policy or
wouldn't
that's your
say that I
strategy.
follow it straight away, but I do think that removing your toxins first, and then I always try to start off with diet and lifestyle first because that's easy. It's within reach for all of us. And I hear from a lot of patients like, well, I can't really eat healthy. I'm on a budget. I think that's kind of baloney, right? So, like, you can follow, there's the environmental working group. They have something called the Dirty Dozen and the Clean 15. So, the foods on the Dirty Dozen are things you should always eat as organic, right? Like, I would never let my kids eat a non organic strawberry. They're one of the most toxic things you can do, or spinach or apples. Those should be organic. But the Clean 15, those are foods that don't really carry a lot of residual pesticides. And so those can be eaten without requiring the extra expense of being organic, and taking away those processed food, those ultra processed foods. They strip away the fiber. If people ask me, like, hey, Scott, I just want to do one or two things. How can I fix my GI tract? And I would say, in the United States, I would limit the amount of processed foods and I would increase your amount of fiber. Like, that will go a million miles. That will go a long way. That's not adding a probiotic in. That's not adding a prebiotic in. The fiber technically would be prebiotic, but
Yeah.
just those factors in of themselves will start to switch your microbiome. That seems easy enough to me. I don't know why people just don't do that.
I mean, alcohol would be another thing. I know no one wants to hear limit alcohol consumption, but alcohol is a toxin itself and it's going to kill. But I mean, you pour rubbing alcohol to kill like bacteria in a wound, you're consuming alcohol, which is a known toxin. That's going to destroy gut health
Very
right there.
much.
So we've kind of gone through kind of what is the gut microbiome, what is, what kind of disease states, what increases, what decreases gut health, and kind of linked it with some diseases and pretty much the steps to get back onto it. So many people are looking forward towards this podcast that so many, as I start talking to patients and people around Pursuit, they start asking me questions. So we're going to do, you don't have to go in depth here. We're going to do a quick fire from Pursuit patients that they have questions for you.
Do
Are
my
you ready for
best.
that?
I'll
Okay.
try.
Question one is, can you get rid of SIBO?
Yes, it has a high recurrence rate. And I think SIBO is the symptom level, right? Like if someone came to you and said, Ron, my foot hurts, there's a big difference between being shot with a nail gun or getting stepped on by an elephant. Like there's a big difference between that. So to me, the SIBO is the symptom. Like we can get rid of the SIBO temporarily, but until you identify the reason why the SIBO occurred, you're going to be at high risk for recurrence. Even when you do everything right with SIBO, the recurrence rate within the first 3 months approaches around 64% when you do everything right. And most people don't do it all right. So these are often people that come
So
back because they
you
don't
would
follow the plan specifically.
you would say that it has a high recurrence rate because we haven't solved the trigger?
That's right. So the small intestine, like we talked about, the small intestine has 10 to the third bacteria versus 10 to the 23rd in the large intestine. Now, to maintain that, the human body has multiple levels of protection. One of those levels have had to fail you to get SIBO,
Okay.
right? You
Yep.
lost your migrating motor complex. You don't have enough stomach acid. Your ileocecal valve is incompetent. There has to be some other underlying reason that left you vulnerable. Now, for some
Okay.
people, it's just happenstance and bad luck. Like, oh, I went on a cruise. I'm really disparaging cruises. I don't mean to. And I end up with food poisoning. And it's not uncommon right now in the United States. The mainstream medicine still thinks the number one cause of SIBO is post food poisoning. Like it can even be
Okay.
like a year or two post food poisoning. I think that things like proton pump inhibitors are probably catching up to that very rapidly. Overuse of antibiotics, other disease conditions. I also think that people who are using GLP-1s because of the way it slows down motility, we're not seeing
Hmm.
it yet, but I think that pretty soon they'll be looking for some SIBO management
Yeah.
themselves because they're purposely slowing down motility for
Yep.
weight loss, which probably has multiple advantages and it might even be more advantageous than it is detrimental. But SIBO is going to be on their horizon.
Okay. You've already mentioned this briefly, but how do you fix leaky gut? That's number two.
Yeah. So again, I approach it with lifestyle interventions, trying to get optimization of sleep. I mean, again, these are way harder to do than just me talking about them, but finding ways to reduce stress, box breathing techniques, yoga, this stuff works really good. And then once we have that stuff in place, then we start using some targeted nutritional supplements. And like I said, I like to use a supplement, at least one piece that targets all three of the layers. One piece that targets the epithelium. The most common one here would be L-glutamine, but N-acetylglucosamine, which you guys probably use for joint repair. That
Hmm.
also helps heal the leaky gut. Zinc carnosine helps heal leaky gut. The mucosal layer can get thickened by aloe vera extract, slippery elm, marshmallow root, licorice root extract. And then, of course, the microbiome, which is where most people are familiar. That's your probiotics, that's your prebiotics, even some postbiotics, what the probiotics make when you feed them prebiotics, that can be useful, like things like, say, butyrate can be
Hmm.
helpful.
Okay. Number three is can you actually change your microbiome or is it set for life? We've briefly gone over this one already.
Yeah, I have to say that I've been doing this a long time. And if you would have asked me this question 18 years ago, I would be like, listen, it's a really uphill battle. Like it's going to take constant management. But the newer research shows that no, this is quite malleable and flexible, and the GI tract will adapt. It will adapt,
Okay.
change
This
for
is
the
a,
better.
yep. This is a good one. Number four is can you have too much good gut bacteria?
Of course. There's no rule saying that dysbiosis or a SIBO has to be too much bad guys. It could be too much good guys as well.
This is a question. This is my question. You ready? Number five. Does having a C-section at birth directly impact the quality of the child's microbiome?
Maybe. So there are some things that you can do nowadays. So if you have a OB/GYN who's in the know, if you're planning on doing a C-section, like you're a VBAC or something like that, you've already had a prior C-section and vaginal birth is not an option for you. Some of the OB/GYNs will actually put cotton gauzes in the woman's vagina and they'll use them as a swab to go over the baby's face as soon as they're delivered. Otherwise, the first exposure to bacteria is an operating room, and that leaves us at risk for weird microbiome setup with like nosocomial infections. That means infections that are common in hospitals that you don't see outside the hospital. That's their first exposure.
Interesting. So then, I guess a follow-up question with that is, if the mother has poor gut health, will the baby have poor gut health?
Um, I don't think it's set in stone, but I think it's going to probably be a high risk factor for a couple of reasons. One, A mom with poor gut health probably has high levels of stress. Those stress hormones can cross the placenta, probably contribute to the development of that GI tract. And then a parent with poor gut health is going to probably have bad lifestyle habits that we passed on that will probably be a big contributing factor as well.
Hmm. Okay, perfect. Number six, what are the top two things you can do to fix your gut?
So we kind of talked about this a little bit. So if you want to help your GI tract, don't put junk into it, right? There's no such thing as junk food. There's junk or there's food. It can't be both. You can't combine them together. You can't make that a portmanteau. Like that should not be a word, right?
Yeah.
It should not be a word.
That's a good one. That's
And we
good.
only eat junk. Like a new study came out, and I think it was like 80% of the calories that were consumed by the average American teenager are processed foods.
Mhm. I
80%.
mean,
That makes me
when I was
cry.
in like middle school, I remember thinking I was healthy and eating a salad, but I took all the ham cubes and the ranch and put it on top of some greens and thought I was eating healthy. So, yeah.
Yeah. And again, it's
Chili,
you don't need
chili.
to be perfect. It's not like
Yeah,
you can't eat that stuff every once in a while, but it can't be the dominant part of your diet. Like you have to eat mindfully of things that your GI tract likes. I tell people this all the time, take care of your GI tract and it will take care of you.
that's so good. Yep. I used to say that take care of your body and your body's going to take care of you too. So that's good. We've already gone over seven, why SIBO has high reoccurrence rates. This is a good one. Number eight, what does the role of methylation play in gut health?
So you see me light up here. You know, I love talking about methylation. For those of you who don't know, methylation is one carbon, three hydrogen. This is the only one carbon donating system in the human body. We are a carbon-based life form. So when something breaks in the human body, we need something that donates one carbon unit at a time. If you had somebody drive a car through a brick wall at your house, you don't call up Home Depot and say, I need 50 feet of brick wall. You say, no, I need 500 individual bricks. This is the individual brick. This is how you repair barrier functions. The GI tract mucosa is a barrier function. This is how you control epigenetics, right? So when we talk about things like MTHFRs and COMTs and all these other things, these are all epigenetics. We know we can turn them off and on with good methylation. The better you methylate, the more you can keep your bad genes suppressed and let the good genes rise to the top.
So that's a
Super.
good point. You can turn on and off genes. That's what
Yes.
epigenetics is the environment and the factors you put in your body that turn on and off genes. Now, what is methylation from a point? Because like the most common thing is like supplementing with folate and your body can't process it. So you need a methylated version of folate to be able to process it. Can you explain the methylation for the average person?
Yeah, sure. So when you eat folic acid, that is a synthetic form of folate that was required to be put into all processed foods. Again, processed foods, not great for you. It has to go through an enzyme called dihydrofolate reductase, and then it turns into folate, which is what you'd get from eating green leafy vegetables. Folate then gets converted by dihydrofolate reductase again into the tetrahydrofolate pool. And then finally, it goes through an enzyme called MTHFR, methylene tetrahydrofolate reductase, and this converts it to methylfolate. This is the form of folate that's used for methylation. This helps to recycle homocysteine back to methionine, keeps that methylation pathway going. The other thing that methylation does is it's key for detoxification as well, because it's the primary driver of your glutathione functioning. Glutathione is the primary intracellular antioxidant and detoxifier. So
So
methylation plays a big.
if someone cannot methylate, meaning they have a version or the expression of the MTHFR gene mutation. So if someone can't methylate, are they predisposed to gut health problems? Is that the link, or did I say that wrong?
No, I think you said it great.
Okay,
Actually,
so
we've
if
known for
someone
a long
has,
time that
yeah,
having an MTHFR anomaly leaves you at higher risk for colon cancer.
okay. So that's the thing that people have to pay attention to. If they have an MTHFR gene, if I say that correct, MTHFR gene mutation, that they may be at risk for having poor gut health because they can't methylate the things they need to be able to process it.
Yeah, so the primary MTHFR is called the C677T. If you have a homozygous break on C677T, that means that mom gave you a bad side and dad gave you a bad side. You are 70% behind the average person on converting folates into methylfolate. And so 30%, like that doesn't work in any form of life. That's not conducive to success,
But
right?
it is a problem for gut health then too.
Very much so. Very much so.
Okay.
Through via epigenetics, it's not direct, but through epigenetics, keeping mucosal layers intact and healing mucosal layers, detoxification. So plays some significant
Yeah.
roles.
So then the last question is the HLA-B27 gene. Is this the same thing that you can turn gene expression on and off? So whether someone tests positive or negative for this, is there a link with, autoimmune pathology like and gut health problems, diverticulitis, ankylosing spondylitis, psoriasis? Is there a link with it? And is that another example of you can turn genes on and off?
So HLA stands for human leukocyte antigen. The best analogy, even though my wife is not a big fan of this one, is if you ever watch episodes of the show Cops. If you watch enough episodes, you can start telling what gang people are in by what tattoos they have. So HLAs are on all of your white blood cells. So each white blood cell knows like what that white blood cell does. And so an HLA-B27 does leave you more vulnerable to certain disease conditions. In your world, it's mostly going to be associated with reactive arthritis and ankylosing spondylitis, but it does have a few other indications as well. This one is not controlled via methylation to turn this one off and on, at least not to my knowledge. So gut health is really imperative here, not because it changes around the HLA-B27, but it's the trigger that activates the HLA-B27. So the healthier your GI tract is, the less likely you're going to ever encounter that trigger that leads to the disease state. Unfortunately, most people don't know they have the HLA-B27 until they get the disease state, and then they find out in retrograde, they find out in reverse that they have it after the fact.
So there's even times, like going back to that analogy, where autoimmune pathology happens because of two things, poor gut health and a trigger. There are cases where poor gut health is the trigger, too, in that
I would
example
say
that you
that's the
just
case
said.
for every case of ankylosing spondylitis that you've ever seen.
Okay, so regardless of the HLA-B27 gene, can you fix the gut and turn off the autoimmune response in an ankylosing spondy patient or reactive arthritis patient?
Yeah, I wouldn't say that you can put that disease state into remission, but I can tell you this, that with a healthy GI tract, it's not throwing off as much inflammatory cytokines. It's way easier to manage inflammation without having to be on those high powered medications. And so you're going to find it to be easier. I don't think gut health in and of itself is going to turn off ankylosing spondylitis, but it can play a big role in its management, long term management.
So for all autoimmune pathology, you just can't fix your gut health and take out one lever. You can decrease symptoms of certain ones on
Yeah, I mean, I
certain
think some
disease
you can reverse.
states.
I think you can some you can reverse,
Yeah.
but some you can only manage. And I would go one step further to go beyond just autoimmunity. I would say anything that's inflammatory, even if it's
Okay.
not autoimmune based, can be helped by having a healthier GI tract.
I'm sorry to do this. This is the last question. You like what you just said with that last question just triggered something. If someone has been diagnosed with active mono or chronic Epstein-Barr virus, what does the role of gut health play and why that virus is still active in that patient? Versus I had mono when I was in college and it's not active in me. But is gut health a risk factor of why someone who has a chronic Epstein-Barr virus state or has been diagnosed with chronic mono, would that play a factor in why that's still active?
Yeah, that's the easiest question you've asked me today so far, Ron. So when you get Epstein-Barr virus, your body can never completely resolve it. So let's just say it gets rid of like 99.9% of it, 0.1% is left. It's got a little bit of a dust bunny that's in the back corner of your closet. You know it's there, but no one's going to see it. Like whatever, I'm good enough. And it just stays there, and your immune system keeps it managed. Now, if something diverts the attention away from that immune system, the immune system has to pay attention and interest in something else. That leaves the door open for this infection to regain traction. And you can identify Epstein-Barr reactivation by looking at the EBV EA marker, the early antigen, because once you have the IgG markers, those are going to probably stay with you forever. So it's hard to tell acute versus a
Mm-hmm.
past infection. But your EA is the indication that it reactivated. So the GI tract, 70% of your immune system, if all of a sudden you start getting a really severe leaky gut or you have inflammatory changes and immune system activation through your GI tract, that's just enough of a diversion to allow that EBV to exacerbate. I would say it's the only thing, but I think it's probably a pretty common reason why.
Okay, we're going to finish up here. Again, we've gone over a lot of stuff. We want to try to keep this in under an hour, but we've gone over a lot of stuff. What is gut health? What is the gut microbiome? How do you increase it and make it better? What are some disease states we highlighted on steps to recovery? And we went through the quick fire questions. So, I mean, I could talk for hours with this on you. again. But the last question we have is, what are your three favorite restaurants in Orlando? So we have a pursuit poll of the top three restaurants around Orlando, Florida, and
Okay.
it fluctuates with time. And we ask every patient, like, who doesn't want to talk about food? What are your top three restaurants around Orlando?
Ooh, okay.
We're going to judge
I
you too if it's all processed foods and stuff like
no worries.
that. I'm just
I
joking.
understand. Um, I really like good Italian food. I really have a thing for Prado
Hmm?
in Winter Park. I know they had a
Yep.
little bit of controversy here recently. I'm willing to give them another chance, but I've
Yep.
always had a good meal there every time without fail.
Nice.
I love that. I also enjoy Mexican food.
Hmm.
And the one that we have closest to us that I really like is Agave Azul
Oh yeah, agave azul is so good.
in Winter Springs. I think that's a really good restaurant. And the third one, that's you're really pressing me here. Um, Third restaurant that I like here in Orlando. It's gonna sound a little gimmicky and touristy, but I like Morimoto's
Oh, okay, yeah,
in Disney Springs as well.
yeah,
There's just something about those ribs that they're so
yeah,
tender. You eat them with a spoon. I
yeah,
would say those are, if not my absolute three, they're gonna be in the top of my list.
yeah. If you really like Italian, you gotta try Francesco's in Maitland, Enzo's on the water north of Orlando, and then there's one right here in College Park. Adrianico's, there's a little hole in the wall.
Mm,
Everyone said it's so good. It's like home style cooking, and every Italian says that their mom's Italian dish is the best, and then everything else falls after that. But Adrianico's is also a really good one over in College
nice.
Park. You have to check out that one. So anyway, we're going to finish up with this. Scott, thank you so much for taking time out of your day to join us. And I would say if anyone in Florida or anywhere is listening to this and you're struggling with autoimmune disease, any kind of behavioral issues in kids, pans, pandas, name it, consult with Scott. Scott is the best. Scott is doing awesome work. He gave me my daughter back, so it's more than just talking clinician to clinician. Scott is doing some fabulous work, and I believe that you're probably the best functional medicine expert we have around here. So I will continue to be sending you people. People are loving your experience and you're changing lives. So I appreciate everything that you're doing. And I just want to say thank you again for hopping on the podcast. And I think a lot of people are going to benefit from this and we'll take the first step in getting people fixed and getting better. So thank you.
Ron, I appreciate you letting me on here. And I have a new project I'm working on actually called Functional Health Academy. And so your listeners may be interested in this. If they go to fxhealthacademy.com/checklist, we've devised a leaky gut checklist. That's a free download there. They can check
Nice.
that out.
That's awesome. Perfect. I'm going to have Scott's clinic and all of his information in the description below. So if anyone wants to get a hold of him, you can go to his website there. Thanks again, Scott. Have a blessed day, and we will be in touch.
Great to see you, Ron.